you have anything else or a bit to add?
Well, I guess as it pertains to the pandemic, I think the government could have done a better job in supporting the operations of a First Nation Child and Family Services Agency. As it pertains to the Manitoba provincial government, yeah, there were no additional resources, financial resources anyhow, to deal with the day-to-day stuff. There was a time when they gave us little paper bags with a rubber gloves and a mask. And what else was in that paper bag, Marlon? A gown and goggles. We had those issued to us. You know, we had hand sanitizer, supplies of that we would go pick up, that we were able to provide, that we had to use, obviously. And then after the vaccinations were out, we were able to get some self-tests that we could utilize within the agency for our own operations and for our own workforce issues. They had, the province had regularly issued out directives within the sector, but most of their directives were concentrated on the group home sector within child and family services, like the workers that work in group homes and other residential situations that are living in homes around the clock with children in care.
And I just would add that I don't think Indigenous people have received the support that they needed during COVID. Like I said, with regard to another research project I'm involved in, I have spoken to numerous individuals who have been engaged in the sex trade over the COVID, and a lot of them, they became homeless in the process, right? They've had children, their children were apprehended. I don't know which agency, because that wasn't the purpose of my research, but I do know from my conversations that there are many people who became homeless during COVID, and as a result of their homelessness lost, custody of their children. So they are engaged with the child welfare system, but also knowing that there are some relationships that have been severed because of COVID. And I don't think we know enough about, those experiences to understand, how that came about and why, beyond the fact, that there was a pandemic, but, how were those cases handled?
If they were handled at all.
Yeah.
I say that like in the appropriate manner.
In our agency, that we've been able to account for 52 children/youth that got COVID up until now. And then out of that 52, four of those children/youth got it twice.
And also, Trudy, that reminds me, were there a couple of parents too that also died from COVID as well?
Definitely one parent who died, and her her teenage daughter came into care. We were providing home supports, like family supports, and then the mother passed. She got COVID and got sick. We just had a grandmother this morning yesterday, day before, I think, who we just did a reunification. The kids were living with grandma. She had been suffering. I just found this out. She had been suffering with diabetes-related illness, and I think she had a part of her foot amputated. And she just got COVID and she died. She got really sick. So grandma's gone. And so we were just helping with the funerals, like the family supports for this. I don't know if she died of COVID, but COVID certainly didn't help her already health status.